Today we're going to be doing a normal vaginal delivery, and we're going to assume that the patient is towards the end of the labor process and she feels like she has to push or is getting a lot of pressure, or she says the baby's coming. So you always want to check and do a cervical exam to make sure that she's actually complete and with no cervix and ready to deliver. What you want to do is use these two fingers and go in vertically into the vagina, because the introitus is actually vertical. Once you go into the vagina, that's when you can turn your fingers sideways and feel the top of the baby's head. At that point, you want to start opening your fingers until you feel the inner part of the cervix. So you want to feel the in part inside of the cervix on this finger and on this finger. And this particular model on Noelle, she does have a cervix in here, so because we want you to feel what a cervix would feel like. You never ever want to push if there's a cervix, because you can cause a cervical laceration, which causes a lot of blood loss, and it's very difficult to repair. So you should never ever push with a cervix. Then if she does not have a cervix, that's when you can start pushing. So what you want to do is when the baby's starting to crown, and that is when you're not touching the introitus and you can actually see the baby's head. At that point, you want to make a C or an L or whatever shape you want to call this with your dominant hand. So if you're right-handed, you're going to use your right hand and be on the right-hand side of the bed. Then what you're going to do is take the towel or a gauze or whatever you're going to use and put that over the top of your hand like this. What this does is helps protect from any poo-poo or anything like that. What you're going to do is go on the bottom of the perineum, and in real life, moms have a lot of tissue down here, so you'll be able to support the perineum better than you will on Noelle. So you're going to support the perineum. With this hand, you're going to use this part of your hand to put on place on top of the baby's head. You do not want to put it on top of the perineum where the clitoris is, because that's very sensitive. You're going to want to put it on top of the baby's head. All right, so I'm going to support the perineum, and you don't have to support the perineum until you actually see the baby crowning. In this position, the baby's going to be coming out looking sideways, but in real life, the baby's going to be looking straight down in a normal delivery. On this baby, it does not, the head is not capable of looking over its shoulder. So the baby's starting to crown right now on its own, and we're a cheerleader. So basically, we're going to support the perineum. And then with this hand, we're just gonna put it on top of the baby's head just to support it. Just gentle pressure. Again, not on mom's perineum. We're trying to avoid the baby doing a bobblehead. So right now, we're just being the mom's cheerleader. Great job, mom. You're doing a great job. And you're doing good. You're almost ready. You're almost ready. Sorry, I keep turning the baby. And then once you start seeing the chin, then you know the baby's head is out. So again, we're still cheerleading, mom's still pushing. And again, she's only gonna push during contractions. All right, the chin is out. I'm gonna drop this. Do a pancake with my hands like this. You don't wanna go like this. Do a pancake like that. I'm gonna go straight down with gentle pressure to release that anterior shoulder. I'm gonna go straight up for the posterior shoulder. At this point in real life, the baby's now gonna be coming, it will be born. However, on Noelle, I have to wait until it's released. At this point, I'm gonna put my hand underneath the baby's to support the baby's head, and support the baby, and bring baby all the way to mom's belly. So the reason you want to do a pancake is you don't want to do your fingers like this, because these are sharp, your fingertips. When you're doing the hand maneuvers, there's a high chance for you to do a laceration of the labia. So you always want to do your hands in this position. And then as a midwife, I do not do the delivery. I actually catch the baby, because the philosophy of the midwife service is that the mom does all the work and I'm just there to be her cheerleader.